We, two psychologists with over 40 years of combined experience, share our insights to help undercomplicate important topics. Friendly reminder that this video is meant for entertainment purposes and conversational purposes only. So if you have questions, there are additional resources in the description of this video.
I'm a health psychologist and have also started my own consulting and coaching business and also enjoy presenting at different functions.
I am a psychologist, a coach, an author, and a speaker. And I'm just going to segue us into our topic because I know we're
Okay.
both excited about this. So, our question today is, how do you explain the difference between coaching and therapy to potential clients? So, Stacey, what are your initial thoughts?
I'm so glad this came up as a question because it is a really, really common one and lots of directions to go in this. But for folks who are in need of assistance with past trauma, with healing, with significant anxiety, depression that's interfering with their functioning, those would be folks that would be probably more appropriate for therapy with a licensed clinician who can help them work through all those difficulties. So therapy is incredibly helpful and important for those types of situations. Coaching tends to be more present and future oriented, more in terms of clarity, pursuing change or growth, and sort of assuming that the person is starting from a place of well-being and balance and really wanting some assistance with taking those next steps in the future.
There's an International Coaching Federation, and they are a body out there that is trying to add some standards to coaching practice. Because, as you said, for therapy, there are like therapy is done by licensed
Mhm.
professionals, like licensed psychologists, licensed therapists, and there's a lot of different levels of those. And they are regulated by different licensing boards. To call yourself a coach, you don't have to have a similar type of license. So there are groups like the International Coaching Federation that are creating ethical standards, competency standards. And I say that to let people know, but also they have a really interesting way of explaining who might consider coaching versus therapy. And so they look at functioning from 0 to 10 and functioning of like your daily living. You know, are you able to bathe yourself, go to work, hold down like relationships? And so somebody who needs therapy, they sort of posit that they might be at like a 3, 2, somewhere in that range of the scale. Whereas somebody who's coming to coaching might be functioning more at like a 6 or a 7. The person coming to coaching is not, for example, another difference, is not going to get diagnosed with
Right.
any sort of mental health condition. Coaches do not diagnose. When somebody comes to you, like how do you usually have that conversation about do they need coaching versus therapy?
And I welcome, and I'm sure you do too, those initial conversations to see, is
Mm.
this a good fit? Am I, is this what you're needing? And it did come up, I mean, it comes up often, but even just recently where someone was really unsure. I don't know if I need therapy. I know I'm struggling with this situation in my life. Do I need coaching? Where do I go? And made it clear to her I don't do both at the same time. So we'll pick one or the other, and then let's kind of sort this out together. And so we explored what she was struggling with and what her concerns were. And I, having done this for years, I had in my head a little breakdown of symptoms that might be coming up that would warrant more of a therapy
Mm.
approach. And by working together, we identified and agreed upon what she was coming to get some help with was really most appropriate for coaching. And I let her know, being a psychologist, that if we come across something that seems like, oh, this is really more an indicator that you're needing therapy, that
Mm.
we would gently shift gears so that she could get that support as well.
I love that you've made that distinction that like we can't do both with one client. So
Mhm.
we're either going to be their coach or their psychologist. And that shifting gears though is being able to ask permission to put on our psychologist hat for a moment to say, hey, I'm hearing in what you're saying that it sounds like trauma stuff is coming up, or I'm hearing you bring up the past, several times. And whereas our purpose in coaching isn't to dive into the past, it's to stay with the present and the future. I can support you in finding a therapist who
Hmm.
can help you. Because there's lots of good evidence-based treatments out there for things like trauma, prolonged exposure, cognitive behavioral therapy for trauma, EMDR. There's lots of good resources that we're not going to do in coaching. You can be aware of as a coach how that might be showing up, knowing that that person's also really digging into that stuff
Right.
in therapy and having those informed conversations of if that client were to say, like Dr. Gedeon, I think I need to pause coaching right now and just focus on therapy, like navigating with that with them and supporting them in that and saying, okay, well, you can figure out some clients might want to do both at the same time. Some might want to just focus on one or the other and being a resource for them and whatever they decide to do.
Some are just some nuts and bolts practicalities, insurance coverage. For example, insurance will not cover coaching. Also, the dynamics between the therapist, coach, and client. And
Mm.
so in coaching, it's more on an equal basis. Although I think you and I both agree that the client in whichever scenario is always the expert on their own life.
Mhm.
They may not be the expert in the treatment that's warranted, let's say if they're a therapy client. And so the therapist is seen as someone who has the expertise in the treatment modality, whereas the coach is working alongside them to help them identify and really reinforce their own strengths and the things that they do well and any obstacles that maybe get in the way or any barriers. And so that's the way that the coach functions a little bit differently.
There are similarities between what a coach does and a psychologist does, or what you would get from a therapist. They're both going to be kind. They're going to be empathetic. They're going to ask open-ended questions and listen deeply. And then it's that difference, that bifurcation of, okay, well, the therapist might empathize and listen and then say, hey, research has shown us that X, Y, and Z might be helpful right now. Does that sound like a good fit? Can we explore that? Whereas a coach might say, okay, I'm hearing you say this. What would be your next step? Where do you want to go with that? Where, it's kind of like what you're doing in the moment, whether you're digging in or you're exploring alongside. Those are big differences that come up to me that both have super great benefits to
Mhm.
them. So it's really encourage people to not have to try to figure this out on their own if
Right.
they're like, oh, this is great. I don't know which one I want or which one would benefit me most, knowing that you're not like locked in to one versus the other. If you talk to someone and you decide at that time that like coaching is the way to go, and then as you're talking, you realize, oh no, I really need some therapy too. Like they're going to support you in that and like getting you to that therapist. Like don't stop yourself from thinking you have to know, oh yeah, I heard this great, YouTube video and now I have to know which one I'm asking for. Ugh. Don't stress yourself about that. But like have open, informed conversations and the good people that you're working with are gonna help check in with you and support you of going like, okay, well, what do you feel you need now? And let's get you where you need to be, whether that's us continuing the work we're doing and adding in a therapist or adding in a coach or pausing what we're doing and adding them in.
One of the main things that sticks out for me from this conversation is the fact that both are appropriate, helpful, supportive interventions or things that people can really benefit from. And so it's not that one is better than the
Mm.
other. It's really sorting out what you're needing or what your client is needing at the time and giving them the sort of the right dose of what they're needing for the right issue that they're coming to you with.
I would encourage people to think about key takeaways of coaching is often present and future focused. Therapy will include the present and the future, but also be able to dig into the past,
Mhm.
kind of get to the roots of what you're talking about.
Mhm.
And so there are important aspects to both of those given where you're at any given time and what problems you're trying to solve. So I hope this conversation was helpful for people to listen to and just want to remind you all to please send us messages on YouTube or LinkedIn with suggestions of questions you'd like us to discuss in the future.